11 top health benefits of using baking soda daily. Do you know that social conversations about baking soda have increased by 12.96% over the past year? This simple chemical compound, also known as sodium bicarbonate, has found well-deserved recognition lately, not only for baking and cooking. Beyond these common applications, though, especially in the medical field, its advantages are extensive. Aside from protecting gums and teeth and even treating cancer, its many health benefits come from its properties as an alkaline agent, mildly abrasive, and antibacterial. In today's video that we have for you, we will discuss the top 11 health benefits of using baking soda daily and their impact on the body. It is imperative that you first consult with your primary care physician or a registered dietitian before making any significant changes to your diet or discussing any potential health symptoms you may be experiencing after consuming baking soda. Let's get started, viewers. 1. Prevents acid reflux. The digestive process relies on stomach acids. On the other hand, whenever there is an increase in the quantity of acid, it starts to cause us irritation on a regular basis. Because of its acid-neutralizing properties, baking soda is a useful remedy for indigestion and heartburn. Since sodium bicarbonate is a base, its pH levels are relatively high. A chemical reaction takes place when it comes into contact with stomach acid, which is extremely acidic and has a pH that is near 0. In the course of this reaction, salt, water, and carbon dioxide are produced. Thus, by preventing acid reflux, this process brings the pH level of the stomach near neutral. However, the key to minimizing the impact of stomach acid lies in the way baking soda is applied. Typically, it is dissolved in water before being used to counteract stomach acid. A common dosage involves mixing half a teaspoon of baking soda with a glass of water. Nevertheless, it's crucial to understand that this offers only short-term relief for heartburn and should not be considered a lasting remedy. Did you know that there is a case study that featured a 50-year-old man who had been using baking soda as a self-medication for chronic heartburn? When he consistently consumed sodium bicarbonate, it neutralized stomach acid. However, it also led to increased bicarbonate levels in the bloodstream. The study's findings underscore the critical need for careful monitoring of baking soda intake when seeking this particular benefit. 2. Detoxification. Maintaining good health involves various methods, and while detoxification is a popular concept, it's important to understand its nuances. Some suggest that regular detoxification may be achieved through a baking soda bath, as it may provide soothing effects for the skin and alleviate irritations like rashes and itching. Sodium bicarbonate, or baking soda, is believed to influence the body's pH balance. By alkalizing the blood and urine, it is thought to contribute to the elimination and dissolution of toxins to some extent. However, it's crucial to note that the body's pH balance is naturally tightly regulated, and significant changes are challenging to achieve solely through dietary alterations. When pursuing detoxification, a common approach involves dissolving a small amount of baking soda, about half a teaspoon, in water and consuming the solution. This method is often used as a way to support the body's natural detoxification processes. 3. Oral health. Baking soda offers a significant advantage in oral care as it addresses several key concerns. The mouth's acidity, stemming from the bacterial breakdown of food remnants, may result in enamel erosion and cavities. Baking soda, being alkaline, counteracts this acidity, safeguarding tooth enamel. Additionally, its mild abrasive properties make it proficient at eliminating surface tooth stains, enhancing cleaning and whitening without causing notable enamel harm. Baking soda may be applied in multiple ways for oral health. It may form a paste when mixed with water for brushing teeth, or be used as a mouthwash by dissolving a teaspoon in water. Ensuring gentle usage is essential to prevent potential enamel and gum damage due to its abrasive nature. Extensive research focusing on plaque removal and gum health maintenance has investigated the effectiveness of baking soda dentifrice among adults aged 18 and older. Findings consistently showed that when baking soda toothpaste was used just once, it significantly reduced plaque formation and showed moderate improvements in gingival bleeding indices. This suggests that using baking soda as part of your daily oral care routine may be beneficial. Enjoying our extensive knowledge about baking soda? Don't forget to hit the subscribe button and ring the bell icon for more health secrets and tips. 4. Skin care. Baking soda's basic pH is well known for its skin benefits, helping maintain the skin's natural pH balance. This balance is essential to preserving the skin's protective barrier function and preventing bacterial or fungal overgrowth. Apart from that, its mild exfoliating properties offer advantages. In controlled amounts, baking soda aids in sloughing off dead skin cells, promoting the growth of new ones and achieving smoother skin. Moreover, baking soda exhibits anti-inflammatory effects, making it particularly valuable for alleviating discomfort associated with conditions like acne or sunburn. For individuals with oily skin, it may help absorb excess oil, potentially reducing acne breakouts and enhancing overall skin appearance. It's essential to note that using baking soda in high concentrations may irritate the skin, disturb its natural pH balance, and strip away essential oils. While sodium bicarbonate does not treat eczema, it may help to reduce the itching that this condition causes. The National Eczema Association recommends adding a quarter cup of baking soda to a warm, not hot, bath and soaking for 10 to 15 minutes. Following this, moisturizing the skin after gentle drying is advisable to mitigate any risk. 5. Anti-fungal properties. Baking soda may indeed interfere with the structural integrity of fungal cells, weakening them and rendering them more susceptible to external factors. This effect may compromise their ability to sustain themselves, and it may also dehydrate fungal cells by drawing out moisture, inhibiting their growth, and potentially leading to their demise. As a result, baking soda may be a useful option for treating fungal skin infections. To harness this benefit, you may create a paste by mixing baking soda with water and applying it directly to the affected area. Alternatively, for fungal infections on the feet, soaking the feet in a solution of baking soda may be beneficial. In a study that explored the antifungal properties of sodium bicarbonate, researchers tested 70 different fungal strains responsible for skin and nail infections. They found that concentrations of 10 grams per liter of sodium bicarbonate inhibited 80% of these strains. 6. May relieve urinary tract infections, UTIs. Baking soda, a common household ingredient, may offer assistance in dealing with urinary tract infections, UTIs. As you may know, when consumed, it has the potential to neutralize the pH of urine. This action is believed to create a less favorable environment for UTI-causing bacteria, potentially slowing their growth. By reducing the acidity of urine, baking soda may also alleviate the burning sensation often experienced during urination with a UTI. A study involving 33 women who had urinary symptoms and acidic urine supports this notion. These women were given oral sodium bicarbonate for 4 weeks twice a day at 4 grams each time. Following treatment, their urine became less acidic and they experienced fewer urinary problems such as frequent urination, nighttime urination, and urgency. This suggests that baking soda may be an effective, user-friendly, and cost-effective treatment for women dealing with these urinary issues. 7. May treat canker sore. Canker sores, medically referred to as aphthous ulcers, are a common oral condition characterized by painful, small, round or oval-shaped lesions that may develop on the inside of the mouth, including the tongue, cheeks, lips, and the soft palate. These ulcers may cause significant discomfort, especially when eating, speaking, or even just moving the mouth. Baking soda has a soothing effect when applied to canker sores. It helps reduce the irritation and burning sensation often experienced with these ulcers. The gentle application of a baking soda solution or paste may offer immediate relief. Moreover, canker sores often thrive in an acidic environment within the mouth. By creating an alkaline environment, baking soda may help neutralize excess acidity, potentially reducing the irritation and discomfort associated with canker sores. Studies have shown that baking soda mouthwash may help inhibit the growth of some bacteria in the mouth and prevent any buildup of dental plaque, which may contribute to a healthier oral environment during the healing process. Create a baking soda rinse by mixing 1 teaspoon of baking soda with half a cup of warm water. Gargle or rinse your mouth with this solution for about 30 seconds and then spit it out. You may repeat this process once a day as needed. 8. Enhances exercise performance. During high-intensity exercise, the body generates lactic acid, leading to a drop in pH levels in the muscles and blood, potentially causing fatigue. Baking soda, acting as a buffer, may aid in reducing this acid, potentially delaying the onset of fatigue and enhancing exercise performance. By mitigating acidosis, it may extend the duration an athlete may perform at high intensities before exhaustion sets in. To optimize athletic strength, individuals often consider consuming baking soda in dosages ranging from 300 to 500 milligrams per kilogram of body weight. This is typically ingested approximately 1 to 2 hours before exercise, mixed with water. The primary mechanism at play is the neutralization of hydrogen ions released during intense anaerobic exercise. This helps maintain a more stable pH in muscles and blood, facilitating improved muscle contraction and endurance. In recent years, baking soda has gained significant attention for its demonstrated potential to enhance performance, with improvements of up to 3% observed in athletes engaged in sports such as swimming and cycling. 9. May help improve kidney function. Healthy kidneys are essential for maintaining overall well-being, but severe illnesses may impair their function. Chronic kidney disease often leads to metabolic acidosis, a condition where the blood becomes excessively acidic, potentially worsening kidney damage. Baking soda, by reducing acidity, may alleviate the kidney's workload, potentially slowing the progression of kidney disease as they don't need to work as hard to regulate blood pH levels. Moreover, chronic kidney disease patients frequently experience reduced bicarbonate levels in their blood. Baking soda supplementation may help restore these levels, promoting improved kidney function. In a 28-week study involving patients with severe kidney conditions, 2 doses of sodium bicarbonate, approximately 0.8 and 0.5 milliequivalents per kilogram of lean body weight per day were examined. Findings revealed that the higher dose was well tolerated and more effective in reducing urinary ammonium while raising serum bicarbonate levels. 10. Natural deodorant. Baking soda excels at neutralizing body odor without resorting to the harsh chemicals often found in commercial deodorants. This is why it's a common ingredient in homemade deodorant recipes, frequently combined with other components like cornstarch, coconut oil, and essential oils to enhance its effectiveness and improve skin tolerance. As mentioned earlier, baking soda is alkaline, whereas body odor is typically acidic. When baking soda comes into contact with these acidic compounds, it neutralizes them, effectively diminishing or eliminating the unpleasant odor. This process forms the core of its effectiveness as a deodorant. Furthermore, baking soda has the capacity to absorb moisture. Given that the bacteria responsible for causing body odor thrive in damp environments, reducing moisture may play a role in controlling these odor, causing bacteria. Although not as potent as certain antibacterial agents, baking soda does possess mild antibacterial properties, which may help inhibit the growth of odor-producing bacteria on the skin. 11. Weight management. Baking soda has been suggested to potentially assist with weight management through several mechanisms, although its impact is generally modest and the evidence is also limited. As you already know, baking soda, when consumed in moderation, may act as an antacid. It may help reduce stomach acid and create a temporary feeling of fullness. This may potentially lead to decreased appetite and lower calorie intake, contributing to weight management efforts. A study examined how intravenous bicarbonate affected metabolic changes in diabetic ketoacidosis compared to intravenous saline in 16 patients. Infusing 150 milliequivalents of bicarbonate delayed the decline in blood lactate, which indicates improved metabolic balance. Thus, by supporting better metabolic health, baking soda may impact your weight loss journey as well. Who is most at risk if baking soda is used? Certain individuals are at a higher risk if they use baking soda, especially when it's consumed or applied excessively or without proper guidance. We have mentioned a few groups that should exercise caution when using baking soda. 1. Individuals with kidney issues. People with kidney problems, such as kidney disease or reduced kidney function, may have difficulty excreting excess sodium from the body. Baking soda is high in sodium and may exacerbate sodium levels in the bloodstream, potentially leading to complications. 2. High blood pressure patients. Baking soda's sodium content may elevate blood pressure in individuals with hypertension or those at risk of high blood pressure. This may pose health risks, so it's crucial to monitor sodium intake. 3. People with gastrointestinal disorders. Baking soda may alter the pH levels in the stomach. People with conditions like gastritis, ulcers, or acid reflux should use baking soda under the guidance of a healthcare professional, as it may worsen these conditions in some cases. 4. Pregnant or nursing women. Pregnant or breastfeeding women should be cautious about excessive baking soda consumption, as it may affect electrolyte balance and potentially harm the developing fetus or infant. 5. People with allergies or sensitivities. Some individuals may be sensitive or allergic to baking soda, experiencing skin reactions or digestive issues when it comes into contact with their body. 6. People with respiratory issues. Inhaling baking soda fumes or particles may irritate the respiratory tract, potentially exacerbating respiratory conditions such as asthma or chronic obstructive pulmonary disease, COPD. Baking soda is more than just a kitchen staple. It's a powerhouse of health benefits. From oral health to improving acid reflux, and even aiding in cancer therapy, these 11 health benefits of baking soda prove its versatility and efficacy in various health aspects. However, it should be used with caution. Appropriate dosages and consideration of individual health conditions are essential to avoid these potential risks. Always consult with a healthcare provider before starting any new health regimen, especially if you have existing health concerns. Now that we have discussed the many health benefits of baking soda, there are always other signs of health we should look out for. From kidneys to pancreas. Interested in learning more? Watch. Save your kidneys from damage by eating these 13 foods. Or watch 9 foods to save your pancreas from damage. Watch one, or even better, watch both. Will you be incorporating baking soda into your routine from now on? Let us know in the comments below.